Welcome to the Defeating Epilepsy Foundation YouTube channel. At the Defeating Epilepsy Foundation, our mission is to provide the advocacy and educational resources needed to the epilepsy community and our society. We are dedicated to removing the stigma associated with epilepsy and help to create opportunities for individuals battling epilepsy. In this presentation, we will discuss what epilepsy is, what is a seizure, the causes of epilepsy, how epilepsy is diagnosed, and treatments for epilepsy. Epilepsy is a neurological disorder. Doctors tend to diagnose a patient with epilepsy after experiencing 2 or more recurring seizures. There are 40 different types of epilepsy, resulting in people having different types of seizures. Currently, in the United States, 3.4 million Americans have been diagnosed with epilepsy, and 65 million are diagnosed worldwide. There is no cure for epilepsy. However, around 70% of patients can control their seizures through medication. A seizure is a sudden electrical surge in the brain that affects how it functions. There are different types of seizures that affect people differently. Seizures may be provoked due to a condition or unprovoked. Epilepsy can be diagnosed at any age and can affect anyone, regardless of race, gender, or age. For many patients, the cause of their epilepsy is unknown. However, genetic conditions, brain abnormalities, brain tumors, traumatic brain injuries are examples of what can cause someone to develop epilepsy. Causes also depend on the age of the individual, some being born with epilepsy at birth, while others developing it later in life due to injury or illness. The most common form of a diagnosis is through EEG testing. Technicians place electrodes on the scalp to measure brain activity. CT scans are used to detect abnormalities such as tumors, bleeding, or cysts. MRIs use magnets to detect lesions or other abnormalities. PET scans use small amounts of radioactive material injected to analyze brain activity. Doctors may conduct other cognitive or medical tests to see what areas of the brain may be affected. There are different options of treatment for people battling epilepsy. Anticonvulsant medication is the most common form of treatment. For drug-resistant epilepsy, a VNS can be placed in the patient to send impulses when a seizure is detected. RNS monitors the brain waves and sends pulses of stimulation when abnormal activity is detected. Brain surgery is performed when all other forms of treatments fail. To learn more about what epilepsy is, please check out our resources used in our presentation today. Please like and follow us on our social media pages. Thank you for your support, and together we will defeat epilepsy.